Assalamualaikum warahmatullahi wabarakatuh. Hello guys, how are you today? Yes, finally we have come to the end of the English for Nurse Anesthesia 2 course. And as usual, at the end of the course you will have a final test. The final test consists of verbal evaluation and also written evaluation. And here I'd like to explain the guideline for verbal evaluation too. Okay, these are the topics that we learned on the second half semester. We have learned about intraoperative assessment, including surgical safety checklist, sign in, time out, and sign out. And also intraoperative assessment, especially on emergency situation in anesthesia. And then we move to postoperative assessment. Here, postoperative assessment divided into two. The first is about transporting patient to recovery room, and the second is about handover. And then the last material is anesthesia care documentation. Well, the purpose of this verbal evaluation is actually to review all the materials that we have learned. And because actually we teach English, we are not an anesthesia lecturer, we are English lecturer. So what we teach is the language, not the anesthesia knowledge itself. So of course, the purpose of this verbal evaluation is to know your understanding about the language features, but also we want to check your understanding about the basic anesthetic knowledge itself. So I'm sure that you have learned about the basic anesthetic knowledge in the other course, in your main course. So you have the basic knowledge. And here, I want you to explain what you know in English. So, we check your understanding about the knowledge and also your ability to use English. And then, the other purpose is to prepare yourself for the final written evaluation. Okay, so what to do? What should you do in this verbal evaluation too? First, make a PowerPoint that contains the basic anesthetic knowledge related to the topic that you gave. Yeah, remember the topic that I showed to you on the beginning of this presentation? I will distribute it to you and I will explain about this later. And after you make the PowerPoint, you must explain your PowerPoint using full English. And you need to record yourself while explaining the PowerPoint. And then as usual, upload your video on YouTube and then copy the link on the assignment pocket on Scalza meeting 58 or 59 based on the distribution. You can read the distribution on Scalza. And then you must divide the job fairly. I mean that make sure all group members take part in explaining the video, in explaining the PowerPoint, And then your face must appear on the video during the presentation. And then your video consists of opening, introduction of all members, all group members, and then the main presentation itself and closing. And then the duration of the video is about 7 to 15 minutes. Here is the scoring component. How we will score your performance. We will score by the content mastery, by the diction or the specific terms that you use, and then by the language feature. The language feature, I mean that the grammatical feature, and the sentence structure, and then the fluency and the pronunciation, And the last, the video quality itself. The video quality means that the video must be clear, the audio must be clear, and if it's possible, you edit the video to make it perfect. Okay, and then the components for the content mastery, it's worth 30%, and for the diction or specific terms, it's worth 15%, and for the language feature, it's worth 30%. For fluency and pronunciation, it's worth 15%, and the video quality, it's worth 10%. Okay, this is the group distribution. You can read by yourself. The first topic is intraoperative assessment. Surgical safety checklist, including sign in, time out, and sign out, will be presented by Fitrianingsih, Dwi Atika, and Nisa Mega. And then for the second topic, intraoperative assessment, emergency situation in anesthesia, will be presented by Milka and Azza. And then post-operative assessment, especially transporting patient to recovery room, will be presented by Khairul Amin and Romantika. And then topic 4, post-operative assessment, especially handover, it will be presented by Farah and Harnita. And then the last topic, anesthesia care documentation, will be presented by Nanda, Farah, and Ratri. Well, that's all the guideline for your verbal evaluation too. I hope you understand, but if you have any question, just feel free to ask. Thank you very much for your attention. Good luck.